We're at the Robert Mangaliso Sobukwe Hospital in Kimberley this morning. This is where Gift of the Givers, or doctors attached to Gift of the Givers, are performing surgeries for this past week and actually since Thursday to basically clear the backlog that is experiencing here at the RMS hospital. Let's talk to the head of the department, Dr. Ahmed Prayat. Doc, so this project is in response to a very big backlog being experienced here at Robert Mangaliso Sobukwe Hospital. Tell us about that backlog.
All right. Ever since COVID, when we had a lockdown, we started experiencing more and more patients coming in needing operations. But at the same time, unfortunately, due to problems within the hospital, staff problems, we couldn't do the number of operations that we used to do previously. And it got to a stage where patients were waiting for months for operations. It's not that we didn't want to do them, we wanted to operate, but we had issues with theatre staff, anesthetists, etc. I spoke to my superiors, and eventually in desperation I went to Dr. Imtiaz Suleiman of Gift of the Givers, told him what my problem was, and I promise you within minutes of me contacting him, he put a notice up on the Gift of the Givers volunteers group, and the response was unreal. We had responses from general practitioners, neurosurgeons, from physicians, allied medicals such as occupational therapists, physiotherapists. And eventually I had to say, thank you guys, but all I need is theatre sisters and anesthetists.
And tell us about, they flew in on Thursday, you said earlier. Yes. So from the time they touched down, what has happened and how has that impacted on that backlog that you are so frustrated about?
Okay. So the team consisted of 5 theatre sisters and 4 anesthetists. And then one of the anesthetists in private from Kimberley also volunteered, so that made it 5 anesthetists. What happened is on Thursday, the first group came down, that's the nursing sisters. We came to the hospital, they took a walk around, they looked at the theatres, got everything ready for the next day. We started at 8 o'clock Friday morning. We worked through till 9 o'clock at night, virtually non-stop. In fact, even lunchtime, we sort of swapped around so that people could go and grab lunch, but the list carried on. Then on Saturday, that's yesterday, again we started at 8 o'clock. We managed to finish a bit earlier. That was around about 8 o'clock in the evening, so it was a 12-hour stint again. This morning, again, we started at 8 o'clock. We hope to finish by 5. By the end of today, that's over 3 days, we would have done something like 72 procedures, which is amazing. And, you know, my department, the Department of Surgery, my fellow consultants, and my medical officers stood by me, and without them, I wouldn't have been able to pull this off. And it's a very, very big thank you to my team. Together with the support that we had from the management of the hospital, the nursing staff, the porters, the cleaners. You know, surgery is a discipline we can't work in isolation. We need the support of everybody, and that's from the cleaners right to the porters, the nurses. I need all their support. And everybody came to the party. We had no squabbles, no arguments. Things went very, very, very smoothly. And I have to say thank you very much to everybody, really. It's been a team effort. At the end of the day, we did this for the patients. To see the joy on the face of our patients, knowing that they're going to go home, they've had their procedures, no amount of money in the world can compensate you for that.